Welcome to this week's program of For Your Health. I'm Luann Wells, Community Service Coordinator at St. Luke's Hospital, and your host for this weekly program. Today's program is entitled Mrs. Smith is Having a Baby, but it's not about the usual pregnancy experience. Mrs. Smith is a high-risk mom. That means that she's going to need specialized care, as will her baby after it is born. And to help us follow Mrs. Smith through her pregnancy and to understand what's happening to her baby, I have a special guest with me. Her name is Karen Severson. Welcome, Karen.
Welcome.
Karen is the head nurse in the special care nursery here at St. Luke's Hospital, and she is also a clinical nurse specialist. Karen, what is the special care nursery here at St. Luke's Hospital?
The special care nursery is actually a 12-bed level 2 nursery, and a level 2 nursery means that we're able to care for children with specialized problems, whether they be respiratory problems or endocrinology problems. We can provide on-site specialized care for the neonate, thereby preventing transportation of the baby to a regional center, thus obviously separating the baby from his family.
And so what does this mean to the community, to Racine?
It's real important for the city of Racine to have available on-site services to care for high-risk moms and babies. In some situations, we can identify early that there are risk factors, and through the expert care of the obstetrical physicians in the community, we can resolve or alleviate some of the problems. On the other hand, there are some babies who are at birth going to be risk for a variety of reasons, and for one it may be because of prematurity. And it's real important for the city of Racine to have immediate access to the quality of services available here at our hospital.
Do you think we could meet Mrs. Smith, Karen?
Oh, we certainly could.
Okay.
Linda is 6 months pregnant, and she's in for a routine office visit. She's starting her second family. She already has 2 teenagers and is expecting her 3rd child in May. During her pregnancy, Linda will be seen about once a month until the last few months, when she'll be seen more often. All pregnant women are evaluated for the development of high-risk factors.
Linda is going in for exam now. Let's listen in as Dr. Miller updates Linda on her pregnancy status.
Linda, I wanted to come in and talk with you because I want to go over some of the tests we've done on you.
Mm-hmm.
You know, a couple weeks ago we did a glucose test where we gave you some sugar water and then drew your blood sugar. And that came back kind of high, so we had to do a second test, and this was a glucose tolerance test. And you'll remember that one because you had to be fasting all night, you had this big sugar water,
Yes.
and you had bloods drawn every hour or so and everything like that too. We had got the results yesterday, and I knew you were coming in today, and it was slightly abnormal in that 2 of the values were high.
Mm-hmm.
Now, since those values were high, we would classify you as a gestational diabetic. Now, that doesn't mean you're diabetic or anything like that. It means that during this pregnancy, your body just can't handle sugar very well. And so you have a high sugar all the time. Now, that would make this pregnancy more of a high-risk pregnancy than before. And it has implications as far as what we're going to do later on. Now, the biggest problem with this is if there's an increased chance of having problems with the delivery or, excuse me, taking care of the baby afterwards. The biggest problem is that the babies, when they're exposed to all this sugar all the time, they're exposed to sugar, and their insulin is increased, and then they grow bigger and bigger and bigger. And so the biggest problem is a big baby. Now, that really only comes into play when they actually try to have the baby, and then there can be shoulder dystocia, there can be problems with the delivery, and I would certainly want to avoid that. Also, after the baby is born, the baby can become hypoglycemic in the nursery because it's used to all the sugar, then all of a sudden there isn't anymore, and so it will react to that. So what we have to do is somehow lower your sugar,
Mm-hmm.
and hopefully prevent all these problems. The first thing we're going to do is have you see the dietitian, and we're going to give you a diet. It's not going to really be a diet so much as just telling you what kind of foods you should and should not eat. And then as we follow on through the pregnancy, we're going to do some more blood sugar tests, either fasting or after meals or after some more sugar water. And we'll probably do non-stress tests down the road, too.
What will a non-stress test show me?
Well, we're going to look for the non-stress test. We're going to look if the baby's in good condition and not suffering because of the high blood sugar and everything. Even if we may even consider insulin later on if your fasting blood sugars are high, and this would certainly make you a very much more high-risk patient.
Mm-hmm.
Any questions?
No, I think you've explained everything very well. If I have questions, I'll definitely be coming back.
Luan, as a result of her identification as a gestational diabetic, Linda is now going to be identified as a high-risk mother.
Well, let's continue to follow her, Karen, but first we're going to break for a commercial, and then we'll be right back.
Medicare Form B, carryover expenses to Medicare 4402, see Schedule R for...
Medical claim forms. They never seem to end. But now you never have to be frustrated with the bills or bureaucracy again, not if you have Senior Advantage. St. Luke's Hospital can help you eliminate hours of frustration associated with medical bills. We'll work directly with Medicare and your supplemental insurance and help you sort things out so you never sign anything you don't understand. The Senior Advantage Pass is your invitation to the Get Off Your Rocker program, featuring exercise to keep you independent and healthy, a discounted meal program, and many opportunities to meet new friends who share common interests. St. Luke's Senior Advantage puts you in touch with the Racine Visiting Nurse Association. Plus, there are leisure trips, health information, and special VIP treatment. And that's just the beginning. Why not take advantage of being a senior with Senior Advantage? It's free from St. Luke's Hospital, the hospital built on care.
Serving Racine every day, we're MedTech Ambulance Incorporated. MedTech Ambulance specializes in transfer care for the elderly. Our state-certified emergency medical technicians will ensure that you have a safe and comfortable transfer. We also accept Medicare and Medicaid assignments. MedTech is also equipped for critical care transfers. Our advanced life support teams will ensure you have the highest level of care between hospitals. For ambulance transfers across the state or just across town, Racine calls on MedTech Ambulance Incorporated.
We work for you, Bank of Elmwood, Bank of Elmwood, Bank of Elmwood.
If you need a loan for just about any good reason, give one of our loan officers a call. We can help.
We're the home of red carpet service for you. For you, we work for you, Bank of Elmwood. Red carpet service for you, Bank of Elmwood.
We're back on For Your Health discussing high-risk pregnancy. Karen, what happens to Linda now?
Well, Luan, at this point in time, she has been evaluated by our obstetrician. And as a result now, what we'll need to do is to begin with ongoing laboratory testing. And in addition to that, some very specialized testing of her pregnancy status. That would include non-stress testing, which is done at St. Luke's Hospital right at our birth center. In addition to that, she's going to need, obviously, information about her nutrition. And we do have a registered dietitian here, Laura Reck, who will provide her with that information. Besides that, she is going to be needing some information on her diabetic state. And both she and her husband are going to be meeting with Pat Holly, who is a certified diabetic instructor here at St. Luke's Hospital.
Now that we've gone through the foods to avoid, I was wondering, do you have any questions?
Well, it sounds like it'd be better for me to follow the same diet as Linda. Is that correct?
That is very true. This does not include any special diet items. It's regular foods. In fact, the exchange list is used primarily for meal planning. It's a way of including foods for good nutrition in a specific calorie level. Let's go through those exchange groups then. We include the starchy foods, the meats, the protein, foods, vegetables, fruits, milk, and the fats.
Sid and Linda, there will be some changes that are going to happen in your life now. We would prefer that it be a joint adventure, that the two of you working together to produce a normal, healthy baby. The doctor is going to watch closely the blood sugar. If we can keep it stable, it will be fine. We can do it all with diet. Later on in your pregnancy, Linda, we may resort to having you do home blood sugar testing
Luan, both Linda and her husband now have more information about the diabetic state. What's going to be important now is to continue with ongoing laboratory testing and also to begin evaluation of her pregnancy status. This will be done in the form of non-stress testing, which is done at St. Luke's Hospital on its birth center. Here we see both Sid and Linda in the birth center at St. Luke's. Our nurse here is explaining to Sid and Linda about the purpose of the non-stress test and also what will occur during this time. Here we see a fetal monitor, and the fetal monitor is actually graphing the baby's fetal heart rate in response to its movements. It's important during pregnancy to evaluate the ability of the fetal heart rate to increase, because actually the movement takes the place of contractions, which will occur during actual labor. In this particular case, it's important to be evaluating the ability of the placenta to support the baby because she is a gestational diabetic. Linda is encouraged to eat before she comes because it will increase the baby's movement, and the total test should take approximately 30 minutes.
It looks like Linda is coming along fine, Karen.
She certainly is, Luan, and in addition to the laboratory components of her pregnancy, a real important component is going to be the collaboration between the physicians and the care of this new family. We're going to be seeing Dr. Flox soon because Dr. Flox is Linda's chosen pediatrician, and she is now entering her 8th month of pregnancy. And it's going to be important to set a baseline now before the baby is born.
Well, hi, Mrs. Smith. I'm Dr. Flox.
How do you do?
Dr. Miller spoke to me about your somewhat unique pregnancy, and I think it's a very good idea that you came in to talk with me today. I understand that you're a woman of almost 41 years, and you have two teenage children at home, and that you're going to be expecting another child in, is it a couple of months? Okay. And I understand that aside from your age, that you also have gestational diabetes.
Yes, Doctor just told me this past week, and my husband and I are both concerned. We'd like to know what kind of risks are for the child, and what do we have to anticipate here?
Well, babies that are born to mothers with diabetes, whether they have diabetes before the pregnancy or during the pregnancy, are at a higher risk for several problems. The most important thing, I think, is very good prenatal care, which I know you've been receiving from Dr. Miller. But there still are some special problems that we'll have to be prepared for. Probably the most common problem that babies can have of diabetic mothers is blood sugar problems. Now, your blood sugars have probably been high during pregnancy, but uniquely the problem that we see with babies is that the blood sugar can be low after the baby's born. So that'll require close monitoring after delivery.
How long will the baby be considered at risk? Is this just an immediate problem?
Usually for the first 24 hours or so. And after that period of time, we can decrease the frequency of monitoring, and certainly you can quit worrying at that point.
So once I get to take him home, he's not going to be a
No, there should be no problem at all once the baby goes home.
Okay.
Babies of diabetic mothers can sometimes have some breathing difficulties. Even though they tend to be large babies, they sort of act like immature babies. And so sometimes the lungs are a little premature, and sometimes there can be some mild respiratory difficulties. But that and the blood sugar problem are the most common problems that we see. Other problems that the diabetics babies can have are much less common and much rarer, and we don't see those very often. But there is a slightly increased risk of birth defects, slightly increased risk of some kidney problems and heart problems, but those things are not common. So I would anticipate mainly just watching the blood sugars close and being prepared to take care of any special breathing difficulties the baby has. Our nursery is kind of unique for a community hospital. We have a special care nursery and a board-certified neonatologist, and that's a pediatrician who's had special training taking care of sick babies. And he'll be available for consultation if the baby has any special needs. And in fact, I'm going to be speaking with him about your pregnancy because we may ask him to be present or be available at the delivery.
Thank you. That'll make me feel much more comfortable.
Okay.
Before Dr. Flox talks to Dr. Nandial, we'll break for commercial.
When faced with choosing a physician, where do you start? You should start with St. Luke's Hospital's physician referral service in Racine. We can take the guesswork out of your search and point you in the right direction. By finding the right physician for your special needs now, you'll have someone to turn to when you need them most. And they'll already know your family background and history. Our registered nurse will listen to what's important to you. Maybe you're looking for a physician who's close to your home or has flexible office hours. Or perhaps your active sports life requires a specialist. St. Luke's Physician Referral Service helps you make an informed decision by recommending not just one, but up to 3 qualified physicians. Only doctors who've met our high standards of education, experience, and personal care are on St. Luke's staff. Call the St. Luke's Physician Referral Service in Racine at 636-2856. We are here to help from 8 a.m. to 4:30 p.m. Monday through Friday. St. Luke's Hospital, the hospital built on care.
You are about to witness an incredibly effective fitness machine. Airdyne from Schwinn, the only machine of its kind that lets you exercise your lower body and upper body together for maximum cardiovascular benefits and healthy muscle tone. Use the Airdyne for as little as 20 minutes every other day to help achieve and maintain total fitness. Schwinn Airdyne, the ultimate fitness machine.
Dr. Nandiel, Dr. Miller just informed me that a mother that I met with a few weeks ago was in labor, and I'd like you to be involved with the delivery. This is a mother who is 41 years old and has gestational diabetes. We discussed a few weeks ago that the baby might have some blood sugar problems and breathing problems, but we weren't anticipating the baby being born this early. So I think mother is prepared for some difficulties, but I'd like to have you involved with this baby.
Thank you. I just want to ask you a question. Are you planning to attend the delivery, or you want me to attend the delivery?
I had initially planned to, but I think in view of the prematurity and the baby may be sicker than we were anticipating, I think it might be best if you attended the delivery.
Thank you. Obviously, there is a need for one of us to be there, and once the baby is delivered, what I plan to do is to bring the baby to the special care nursery after initial resuscitation in the delivery room. And then I'm planning to put the baby either on a warmer or in an incubator, and we'll be doing some screening tests for low blood sugar.
Right.
And
I did discuss that problem specifically with the mother.
And also, most likely the baby may need an IV, especially if the baby has low blood sugar symptoms or low blood sugar values. And since these babies are large for dates, and also they tend to get lung problems.
Right.
It's a nice idea to have the oxygen available, and we'll be also running some tests to look for the need for oxygen. And these diabetic babies, as you know, they are more prone to get a prematurity of the lung.
Right.
And even though the tests to look for lung maturation can be normal, still these babies may get severe prematurity of the lung, and several times they may need other support like a ventilator, things like that. And doesn't mean that every baby needs it, but some babies do need, and we need to keep a close eye for that kind of problems.
Okay, well, I sure appreciate your help on this patient.
Linda was admitted to St. Luke's Hospital in premature labor, and as a result, she did deliver a premature baby. She delivered a healthy little boy. His name is Jacob Thomas. He was admitted, though, to our special care nursery because there are problems that can be anticipated with infants of a gestational diabetic. Linda is now at the baby's bedside. Let's look in.
Good morning, Mary. Hello, good morning, Mrs. Smith.
Good morning, Dr. Nandiel.
How is the baby doing today?
He's doing good today. He had a real good night last night.
Okay. Can I have a look at the baby's chart, please? Yeah. Okay. Okay. It looks like baby is doing pretty good. The respiratory rate is down to normal, and baby is still losing weight.
How much weight has he lost?
About an ounce from yesterday. And what I thought is maybe I'll review some of the problems baby had so far.
Okay.
And see if you have any questions about the care we gave so far, or anything else we need to do. This baby, as you know, was born about like 5 to 6 weeks premature, and is larger for the gestational age. That means is larger for the size, for the age we expect. And baby had mild to moderate prematurity of the lung. In medical terms, we use the term hyaline membrane disease, but essentially it's like a prematurity of the lung. Lungs are not ready for outside. And so the baby was in oxygen, and we decrease the oxygen slowly. During that time, we monitor the baby's heart rate and respiratory rate, and also we use some special machines to check the oxygen saturation inside the blood. And we did a lot of blood tests to see whether the oxygen levels are too high or too low. Depending on that, we adjusted the oxygen levels. And it looks like baby's, the problem is solved now. The other problems baby had was, as you know, baby had high blood count, which probably contributed to the jaundice baby has. Okay. Also, the infant of diabetic mother tend to get jaundice even without the high blood count, or even when they are not premature. And it looks like baby is getting slight jaundice, but at present it doesn't look like we need to put the baby under special lights or anything, but if the jaundice goes up, we may have to do that.
How fast will that happen?
Usually on an average, full-term babies, they get jaundice on the 3rd or 4th day, but premature babies, you may see them early, see the jaundice early, and it can hang on longer time, like a week or 10 days. Or again, it depends on how premature is the baby. Some premature babies, the jaundice can stay for 2 to 3 weeks, but with your baby, I don't expect the jaundice to last too long.
Okay.
And other problem baby had was baby did have low calcium, which is also an expected problem with babies born to mothers with diabetes. And that was corrected by giving a little extra calcium in the IV. Fortunately, baby didn't have any other major problems, which sometimes may show, like some babies can get some cardiac problems. Sometimes babies, if they're born to diabetic mother, they may have some heart defects, and also they may have some other malformations. But your baby doesn't have that kind of any problems, which is, which we are glad about it. So everything is going on pretty well. Mary, do you think we can start feeding the baby today?
Sure, I think he's ready. He's been sucking in his hands and using his pacifier.
Will his IV come out then?
Yeah, once we start the feedings, I would like to see the baby tolerating the feedings, at least like 3-4 feedings. And we also monitor the dextrose sticks. It's like a blood test to see if the blood sugar is too low or too high. And it's more like a bedside test.
Is his high?
In his case, it has remained within normal range. And I think at this stage we can start feeding slowly and see how the baby does. And gradually we'll be decreasing the IV, okay? And it may take a day or two before we stop the IV completely. And again, each baby is different. Some babies may take a little longer time. Some babies do well right away. So we'll be keeping a close eye on the baby.
Once we take the IV out, does he continue to have to be stuck in the heel for blood tests?
Usually not. What we do is we try to decrease the number of times we are doing the blood test.
Okay.
In the beginning, as you saw, we were doing it every 4 hours or so. Now I think we can make it less frequent, probably once in 8 hours or once in 12 hours, just to monitor that he's holding it pretty good.
Okay.
Okay. And since he got the oxygen, he's at a risk for some kind of like eye problems. Sometimes oxygen can cause bad effects on the eyes. Not every baby gets it again. Some babies tend to get it. As a rule, I prefer to have the baby seen by an eye doctor at about 2 to 3 weeks of age, just to make sure that baby did not have any bad effects from the oxygen.
Okay.
It happens rarely, but it can happen. It's a potential problem. Otherwise, since the baby did not have any prolonged low blood sugar symptoms or any other major problems like seizures, I do not expect any kind of delay in development or anything like that, because that's one of the complications we see is the baby had prolonged repeated seizures, you know, that kind. So I'm happy the way baby did, and I think part of the credit goes to you because you followed the doctor's instructions quite well, and the diabetic state was under control. That makes a difference too.
When can we go home?
It's a good question. I would like to see the baby tolerate the feedings for a few days, and I want to see the baby's gaining weight, and also we have to make sure the jaundice doesn't go up higher, because as you know, if it goes up higher, we may have to put the baby under special lights, which may delay the discharge.
Karen, it sounds as though Linda's going to be able to take a healthy baby home with her soon.
She certainly is. We're real excited for both of them. Jacob is doing very well, and she will be able to go home in approximately 4 to 5 days.
Oh, that's great. That's great. Thanks to the special care nursery and the teamwork that happened between the nursing staff and all the physicians here in Racine.
It really is an exciting opportunity for both nursing and physicians to care for the families, and we really enjoy it when our babies are doing well and able to go home.
Thank you very much, Karen, for helping us out today.
Thank you for asking me.
It was nice having you here with us on For Your Health, and I'll look forward to seeing you next week.